A 4 years old girl is brought to the ER after falling off a swing. She appears to have a fractured right forearm. Sensations and pulses are intact. She is accompanied by her 18 years old babysitter. Both the babysitter and the emergency room staff are unable to contact her parents for consent to treat. What is the most appropriate response at this moment? So take a pause and think of a likely answer in your head. The answer is A. Continue attempts to contact the parents to obtain consent. The key and take home point here is that the fracture is not life or limb threatening. So, in such cases, you need to obtain a consent from a parent or legal guardian. Babysitters cannot give consent legally, and the child is minor, so she herself cannot give the consent. So, you are supposed to take consent from the parents. Option B. Obtain an X-ray and treat the fracture appropriately. As I mentioned earlier, this patient is hemodynamically stable and the pulses are palpable and neurovascular bundle is intact. So you don't need to perform the X-ray and treat the fracture without the consent of the parents. And option C, obtain consent from the babysitter. You cannot take the babysitter just cannot give the consent, and you cannot take the consent from the babysitter legally. And option D, using implied consent, reduce the fracture as you continue attempt to contact the parent. So this is again a wrong answer because the patient is hemodynamically stable. But if the patient would have been hemodynamically unstable, then you could have been proceeded with using implied consent to reduce the fracture, and you could have continued attempts to contact the parents. But in this scenario, you must have to contact the parents and you have to continue to make attempts to contact the parents to obtain consent.